Tim, welcome
Thank you.
to the podcast. To be fair, when I had an idea for a podcast, you were one of the first few people I thought about.
Privileged.
Yeah.
Honoured.
So before we start, could you very quickly tell us who you are and what you do?
So, Tim Grigg, based in Stroud, Gloucestershire. Started off as a soft tissue therapist, so sports massage and the various ways that we can use techniques in that world. Went on to become a sports therapist, qualifying in 2009, which led me into professional football. Very lucky to get a job with Forest Green Rovers, and I was there for 8 years as a senior therapist. Did a couple of years voluntary in the build up to that, and yeah, just moved around within professional sport, and now I'm into my own little clinic.
Yeah, so TG soft tissue
Therapy is my business. Probably could have come up with a better name, because it is a bit more than that. I do look after people with injuries, do some rehabilitation programs, so get guys and girls in who just need some guidance on, it might be something as simple as what can I do to warm up properly before I run, or look at some weaknesses. And
that's a good question. Not everyone knows how to warm up before.
Yeah, and there's everyone's got a different belief.
Yeah.
And what I'm very proud to say, I don't know it all. I do read a lot and try and keep up to date with everything, and I give people my honest opinion and say, right, this is what I think might help you. Let's try it. If it doesn't, we've got other options, because not everyone sits into the same category. You know, we're all very different creatures that walk this earth, and we've got to appreciate that. We can't just print off, here's a warm-up, and hand that out.
Yeah. Some things will work for one person, won't work for the other, depending on all sorts of factors. Yeah. So, I met you for the first time.
Thornbury Leisure Centre?
November. Was it November last year?
Yeah.
So you're wrapping everyone's hands, and it was Ryan Edmondson's first show.
Yeah.
And it was a weird event for me because I was on the last.
Yeah.
So I could see everyone going in, fighting, coming back, losers, winners, injuries or not. And I've got this weird way of preparing for fighting. I'm taken on these sort of emotional journeys with everyone else, because I know some fighters, they go in a corner, put headphones on, and they disappear. I just can't. So I'm not a big fan of these events when I'm fighting very, very last. But it gave me a good few hours to look at you as you wrap hands, and I was really, really impressed. And actually I've written it down here. Your hand wrapping I found soothing and relaxing.
Yeah.
Okay. So apart from the fact that it was very professional, so I've never had my hands wrapped so well. You did relax me, because you did a little bit of massage as well.
Yeah.
And the way you talked me through how to do it, how to turn my hands, you described everything. Well, you talked me through the whole process. These 10 minutes were really, really important in my preparation for the fight that I was going to have in 30 minutes, an hour. So that was a really, really good.
And it's interesting because you get two different types of fighters. Yeah. Generally, you get ones that they like to be nice and calm, like you said, and I pick up on that. So my actions kind of mirror what I see in front of me.
Okay.
So if someone's calm, I don't need to be trying to G him up and, you're about to go and fight. You're going to hurt this guy, you're going to hurt this girl. It's not that at all. It's seeing, it can be actually, that's a lie. If the person is really on, getting hyped up, I kind of jump in on that and, try and help them along with that process. And because it's a really important part. It's the first part of the fight. You get to the venue and you're getting set up, but when you get your hands wrapped, you're that one step closer, and it's like it's reality. I find, and like I say, I will switch to what's in front of me. some guys are really nervous, and it's really hard to get them to focus on make a fist, open your hand, turn. They're distracted.
Yeah.
They've got energy going, and and I love the fact that you never really wrap the same every single time.
Yes.
The process is in terms of the actual physical wrap, but the way you communicate with the fighter can be very different.
Okay. So how did you start with hand wrapping? Was it like a natural thing, or?
Absolutely no idea. No. People ask me this all the time, and to be honest with you, I'm not too sure. I guess when I've worked in sport and I've taped, predominantly in the football world, when I would tape ankles, I'd always get a lot of feedback that I prefer your taping technique to others, and it's like, perhaps it's one of my assets, is what I'm really good at. I've always liked MMA, kickboxing, and boxing, and obviously taping has become more popular now. People are starting to understand it's about looking after yourself. And literally I think I just brought a couple of bandages, started practicing on myself, and chucked myself in the deep end and just went into a couple of gyms.
Because it's hand wrapping, it's this very underestimated preventative
it's huge
thing. Do you think it's taken more seriously recently?
now and you can see that through the local shows.
Okay.
You still got a few guys who will wrap their hands in crepe bandages that you can buy from Boots for 20p, and that's fine, that's okay, but to do it professionally, it doesn't cost that much more, and you do get a far superior wrap, and you can do it yourself if you want to. I practice on myself all the times, different techniques, and what about this idea, does that, I'm not a fighter, I'm a lover, not a fighter. But and it's I think it is growing in popularity.
Yeah,
definitely.
I think it just takes several people to just really badly damage their wrists or knuckles or whatever, and then they. But what's the point? I don't think I would be able to even do any sort of pads with my coach or hit the bag without my hands wrapped. It just, I find it strange.
And even
very uncomfortable as well.
What to not have them wrapped?
Yeah, to not have them.
It's once you've had it done, it does give you a taste of, wow, that's what it feels better.
Yeah.
But you can talk about conditioning of hands. Your hands need to be conditioned as well. If you rely on a big heavy wrap, there is going to be an element of your hand will decondition. So if you were to put on like a normal lighter wrap, your hand isn't going to be as strong. So it's
more likely to get injured.
Yeah, potentially.
Whoa.
It's like working with any professional athlete. The tape is a preventative measure to stop that injury from reoccurring. In the build-up to games, fights, whatever it may be, they should be working on preventative measures to stop that injury from occurring. So, really, the tape is, in that scenario, is to stop it from happening. But what you really want to happen is that player gets weaned off of that, because the injured area is back to full strength. It's a bit different for hands, because you're doing it more for padding and to stop the forces that go through. But you must have worked on like some heavy bags, and you see some of the old school guys where they might just wear some gardening gloves. That's more so to stop skin irritation.
Yes,
but it's a great way to condition the hand and toughen it up.
Yeah, well, the same thing we do with shins. We just kick very heavy bags just to build up this extra layer of whatever there is on the skin or on the bone. Yeah. So it just gets harder.
Exactly. Yeah. So it's a conditioning thing. Yeah. That's important for people to understand.
Yeah. But for someone like myself, because obviously different for like truly genuine professional fighters, but for someone like me, that I'd better have my hands wrapped really well.
Well, you've got to go to work Monday, haven't
exactly.
you? If you get injured, and there's lots of pros out there who still work, and they can't afford to get injured.
That's true.
As well. So it is really important. That you get it done right.
Yeah. Okay. So you said you're a sports therapist.
Yeah.
Okay. Now I did a lot of research. I stalked you on your social media, but I also found that there are other professions that do more or less similar stuff to what you do. So we've got physiotherapists, we've got sports physiotherapists, we've got sports therapists,
Yep.
and we've got sports massage therapists.
Yeah, and
And I'm sure there's some
sports rehabilitators. There's lots out there.
Exactly. So where do you fit in with this, and what are like the main differences for the layman like myself?
There's not a huge amount of difference in our approach to, let's say, so you came in with an injured ankle. I'd like to think we would all assess and come up with a treatment plan and a rehab plan that would be nigh on pretty much the same. Yeah. However, someone like a physiotherapist has lots of training in things that someone like myself doesn't. So you may have someone who's had a stroke and they're looking to regain use of the limb post-stroke. At university on physiotherapy degrees, they are taught how to deal with those types of things.
Okay.
On my courses that I've done, it's purely sports, which sounds very limiting, but ultimately, if you injure your knee, say, if the way you rehab it is exactly the same. You don't need to be sporty to see me. Life is a sport, isn't it? I guess. I got to get you up and I got to get you moving, running up and down the stairs, whether you're an 80-year-old or an 8-year-old.
That's a really cool way of looking at it. What sports do you do? Life.
Life is movement.
Yeah.
And if someone's injured, in pain or whatever, my job is to come in and get them moving again, build up their confidence, but rebuild their injury through good rehab, and the hands-on stuff if needed. But going back to your original, physios, qualified in things that I'm not. Sports physios still have that initial background, but they make the decision to go more down the sports route, hence the name sports physio. So they may have qualifications that are more sports medicine related. And then you've got someone like myself, the sports therapist / soft tissue therapist, where we kind of cast our net far and wide. But if you're good at what you do, if someone walks through the door and you're not comfortable, say you come to me with something that's just, there's something going off in the back of my head saying there's something not right here. This guy's got shoulder pain, but I think it might be coming from his neck. If that was something I felt was outside my remit to do my job well, I would refer to someone higher.
Okay.
Which is an important thing to do. You got to realise you can't fix everyone every single time.
You have to know your limitations as well. Absolutely.
Yeah.
Okay. Is there any particular sport you specialize in, or is there approach that an injury is just an injury? It doesn't matter what sport caused it.
Yeah, for me, again, it's most injuries are the same.
Okay.
So I keep referring to the knee. It's just an easy one. But if you tore your cruciate ligament in your knee, so the big stabilising ligament in the centre of your knee, 90% of that rehabilitation will be the same for everyone.
So whether it's a rugby or football,
or you're going to go through a very
or
similar process. Get it moving, get it stronger, and get them to tick off the boxes of running in a straight line. Where it does change, and it changed dramatically, is what does that person need that knee for? So if you're a rugby player, just in rugby alone, within the positions of rugby, that can be very, very different. So if you're a prop forward and you're in that bent over scrummish position, compare that to a fullback who's a sprinter, runner, changing speed quickly. It's the same sport, but there are slight differences in the demands.
I can see that, yeah.
So ultimately, the sport you play does change the end stage of rehab. I'm not going to rehab you to play football if you're a volley player, because the analysis of the movements that you need in that sport are very, very different. So really, you get everyone through the same process, and it changes right at the end to go, right, what's specific to you and what you need.
Whoa. Okay. That's really interesting. So we mentioned rugby. We mentioned a bit of martial arts, obviously running, etc., etc. But is there any particular sports, do you think, that's the main culprit for majority of sports injuries, or it might be something that we underestimate a little bit.
So do you mean what's the main cause of injury?
Well, what's the sport that causes
Every sport
most injuries?
Every sport comes with its risks.
Okay.
Now, some sports you will get more of that one injury. So I can't remember off the top of my head how many cage fighters I've seen with a torn hamstring. They don't sprint long distances like a footballer would.
Okay.
So a footballer, you would see a lot of hamstring tears. Likewise, I haven't seen many footballers with a broken hand or a fractured wrist, but in boxing, MMA, K1, you do, because of the way they use their hands and wrists.
So each sport will have its own little...
Will have its own little sort of specific injury risks,
Okay.
if that makes sense.
Yeah.
But generally, you're going to see lots of muscle strains, lots of trauma. One of my lecturers once said to me, if you ever get a chance to work in rugby, do it, because you will see head to toe trauma.
Yeah.
Whereas in football, in all honesty, it's probably sort of waist down that you tend to see all your injuries, because that's what football is. Whereas rugby, because it's lower limb and upper limb all in one, you get to see lots and lots of injuries in a very, very quick amount of time.
Okay. So even tennis or badminton will be...
So, you're looking at tennis.
So that's more upper body arm.
No, not always, because think about playing on the baseline, change of direction.
Moving,
you can change different surfaces. So players have got to be, in tennis.
So ankles.
Yeah, Andy Murray plays with an air cast brace all the time.
Really.
But look at the surfaces that a tennis player plays on. They could go from a clay court to grass to indoor, and that's a really tough thing to be able to change to all the time. At least a footballer knows he's playing on, grass or artificial grass, which are very, very similar.
Yeah.
Does that make sense?
Yeah. Absolutely.
You got to look at it quite broadly. What we would call a needs analysis. What are the needs of that athlete? What does he or she need to do within their sport? And you said the tennis. Lots of repetitive actions. The serving. So you'll get a lot of shoulders.
Well, that's the reason I mentioned tennis, because I've got several friends who play tennis and they always complain about the shoulders. Yeah. But I've got a lot of friends who fight. Yeah. And again, they complain about shoulders.
And what's the same thing happening there? Apart from movement, it's the repetitive nature of. Tennis player isn't just going to serve 5 balls a session. They're going to do 500.
So when you're on the bag, you might hit it hundreds of times.
Hundreds of times. Exactly that. Yeah. And you do see. I suppose you could call this acute trauma, because it is, but also when someone misses. So if you miss a pad, I've had a few guys walk in with that. So they've thrown a punch, they've missed the pad, and because they're throwing at such velocity, expecting to stop, because their arm travels, all of these muscles have got to stop that action.
Yeah.
And more often than not, that can overload, and that's where a muscle can work really, really hard to put the handbrake on, and then you pick up a little strain, and usually it is a little strain in that way. So,
God, it does hurt when you miss.
You can, yeah.
You're absolutely right. Yeah. But let's concentrate on martial arts.
Yes.
So if you look at just martial arts, whether it's kickboxing or UFC, well, actually, it makes a massive difference. So let's concentrate on kickboxing. Okay. What sort of top 5 injuries would you expect from a professional kickboxer?
Well, again, you're going to get a lot of blunt trauma, aren't you? So big, heavy leg kicks. Although you train to be conditioned to take some of those kicks, if someone really hammers hard.
But if it lands on an elbow.
Yeah, again.
Or a hip.
Yeah. If you hit those bony prominences. Yeah. You can't really train for that sometimes, and it hurts, and you got to put your face on. And
you see these young kids in Thailand rolling bottles on their shins.
Yeah, and again, because if you feel your shin on the outside here, you've got this really, really sharp ridge of bone, your tibial border. On the inside of that's your That's your actual the flat area of your tibia.
You should kick with it, yeah.
And that's what you're trying to condition. So it's just trying to make the outer layer of bone stronger, and that's where I think we're going to get onto this later about movement and why that's so important. But again, I keep going off script, don't I? But
don't worry.
In terms of kickboxing, lots of blunt trauma, like you would in MMA as well. I don't think you could class cuts as an injury per se.
Oh, really?
So someone's, although you can clinically do work with that. I do use devices to make scars a little bit stronger. Because if you don't work a scar, it will heal quite weak.
Yeah. Well, I have the problem. I got kneed a couple of times, and now it's my weak spot. Yeah. So I'm extra careful to guard this side.
Yeah. But other injuries, again, it's all your classic hand injuries, your wrist that you get. Yeah. Freak things can happen as well. You could be getting beaten up a bit, tired. You get tossed to the floor, and because you're just that little bit fatigued, fall down, and you might dislocate a shoulder, which is a freak thing that can happen. But it does happen.
It did happen to my brother-in-law.
Really?
Yeah. So he lives in Holland. Yeah. And even amateurs there, they fight without shin guards, and it's really hardcore. And he had his first fight, and literally first 15 seconds they go into this massive clinch. They both go on the floor. Yeah. He lands on his shoulder, and the other guy lands on top of him. Yeah. Shoulder dislocated straight away. He gets up, tries to bring his arm up. It doesn't go up. Gets knocked out. End of fight.
But how many times had he fallen to the floor, and it's never been a problem?
No.
It's just that freak, which there's a lot of effort goes in to stopping athletes from getting injured professionally, and I think that's slowly working its way down to the amateur levels, where people go to gyms more. They're researching about what they should and shouldn't be doing, but unfortunately, even the most well-conditioned elite athlete can still get injured. Yeah. You're just trying to reduce that chance of it happening, but if it's your time to get injured, if you move in that slight way, which is just unlucky, it's going to happen.
I struggled with distance when throwing leg kicks, and I mean the amount of times I caught my toes on my opponent's knees. It's just absolutely ridiculous. Yeah. And with time, I just learned the distance. Yeah. Not to to throw my hip forward. But yeah, I constantly had injured toes. They weren't broken. It's just really, really badly bruised. Yeah. But it compromised my my throwing punches technique and my movement. So I couldn't train for months and months and months. What about head trauma? Would this be a part of?
Tricky one, because you're talking about concussion. Yeah, that's a different kettle of fish, really. It's trauma's a really under-respected injury, or it has been. I think it's starting to get better.
Well, you will have a really good experience with it working with like rugby guys.
Yeah, and there are very strict protocols that if you certainly now you get a head injury assessment, and if you show any signs of having head trauma during a game, you're off. You get assessed by a doctor who is there, unbiased, to give an opinion. This guy shouldn't carry on, or he can carry on. If it's a no, there's a set of guidelines, certainly in rugby now, that you can't go back and play for so many weeks, and you need to tick the boxes of.
I even heard that they do it in football as well.
Yeah,
I think that changes in schools as well. That kids are not supposed to head the ball.
Yeah, it's a question. It's the world we're living in now, isn't it?
Yeah, but I can see it because I play football every now and then, so I know it can be quite hard to hit.
So here you go then. Here's a little thing. When this all came out, and I thought this. So I've got dogs, and I look after my dogs as well as I can. Love my dogs. I don't know if anyone's had a puppy.
Oh yeah, I've got a dog.
You've got a dog, yeah. So with your puppy, you get told you shouldn't walk it too far when it's young, because its bones are soft, it's growing. You shouldn't do too much. You should only. There are people who put up really strict guidelines, like 5 minutes per month of its age, and things like that, because you don't want to
okay.
hurt the dog. You don't want it to be stressed when it's developing. Now, you could also say that about kids. You know, certainly I did a little bit of sport when I was younger, mainly rugby. But I had friends who would play rugby, football, tennis, and you do get these in clinic, and they present with overuse injuries. And you know, they're injuries that basically come about because they're doing too much.
Okay.
So, you know, you look at what they do, and they're Monday they're this, Tuesday they're that, Wednesday they're this, and you go, well, you're doing loads. Let's take that out, take that out, take that out, and all of a sudden their symptoms get better. But their bodies are growing, they're developing, and they need time to.
Yeah.
Does that make sense?
Yeah, it makes perfect sense.
And I always think, like, well, we treat our dogs well, you know, or generally we know not to push them too hard, yet we throw our kids into sport, which is great.
Yeah.
But on the flip side, you know, sometimes some kids do too much.
Yeah, but I just can't imagine being, you know, 10-year-old and head the ball, you know, hundreds of times. It's like getting punched. And you know, the skulls are slightly thinner, and the
bones will be soft. You don't, you
yeah.
you don't stop maturing till you into your late teens, early 20s.
I mean, we couldn't even have a discussion about, you know, what sort of sparring you have to do. Do you have to do heavy sparring, light, technical, especially when you're on amateur level?
Yeah.
I made a decision about a year and a half ago that I'm not doing heavy sparring anymore.
Yeah.
Because of my height and my weight, I always end up sparring with guys who are a lot heavier. And it's not just head trauma, but kicks. I mean, they would throw me, you know, everywhere, you know, because their legs weigh, you know, half of what I weigh.
Yeah.
So I stopped heavy sparring completely. I only do light technical sparring, even with bigger guys. It's just not worth it.
No. Yeah, the risk reward. Isn't there?
Yeah. And I can understand that some people say, well, you need heavy sparring, you know, a few weeks before your fight. You know, your body needs to know what it's like to be punched, to be kicked, to react better during the fight. And I get it. But I would still rather, you know, have 10 light sparring sessions than one heavy.
Yeah. And you've got to do what's right for you.
Yeah.
You know, everyone's different, and you could probably, if you logged every session or every fight camp, you would notice differences. You know, and you could go, right, is that just because you're getting more educated? You know, you're understanding the sport better, you're understanding yourself better. Is it age? I don't recover so well when I get kicked these days. You know, I could get kicked all the time when I was 18, but now I'm 30 plus. It hurts more, so I need to train in a different way, and that happens.
Age. Why did you have to mention it?
Comes to us all.
Yeah. I'm quite lucky. I'm for my age. I'm 41. I am relatively fit, and when we train, I usually train with a lot younger kids.
Yeah.
I'm not behind at all. So
good.
But there will come a time.
Yeah, well, you know, sure. you become that guy who becomes the sensei of the gym and imparts wisdom, as opposed to go full out and
or the guy who Remi left because he injured his leg, or he had some sort of serious injury, you know, around his back, and he can't train anymore. I wouldn't like that.
No,
I wouldn't like that.
No, not at all.
So you're really experienced, you know, football, rugby, martial arts. Can you remember the worst injury you had to treat, or body you had to fix? You don't have to mention any names, or.
I can think of one injury in football where I had what's called a compound fracture. So a compound fracture is where
several.
It can be. It's where the bone breaks, but it pierces the skin. So
it comes through.
So the bone comes
There's
through.
Bone sticking out.
So it can sometimes be sticking out. It could have just poked out, and it's gone back in, and then obviously you're left with a wound. And if this guy's watching this, he will know who I'm talking about. But yeah, it was in football. Gone to kick a ball in midair. Instead of kicking the ball, he's kicked the bottom of the guy's boot, but mid-shin. So he's made contact on the mid-shin. And you saw it happen in the air. You saw his leg break. The bad thing was he was in the air, so he's had to land, and naturally he's put his foot down, with his leg broken, and that's where the compounds occurred, because he's gone to put weight on it. It's then...
So it broke even further and
Yeah, so
pierced the
he's
skin.
broke it in the air, but then he's put it down to land on like you would do naturally, because you don't feel these things straight away. You might hear something, but it takes a second to sort of register. And yeah, that's where putting weight on it has then caused his tibia to sort of protrude through his shin a little bit. And that was a really weird scenario in a sense. That's definitely the most serious injury I've ever dealt with in person.
Have you been able to fix him up?
Yeah, he got back to playing football.
Okay.
But wasn't professional.
And it's never the same, is it?
No, it can be, but he had more concerns of, I need to get back to work. Football wasn't his career. He was a very good footballer, but the interesting thing with his injury was your training kicks in that scenario. You almost go on autopilot. It's what you're there to do. And the first thing was check blood supply to his foot, and that was fine. You do what's called a capillary refill. So you squeeze the nail, let go, and it should return back to normal colour.
Okay.
He had that, so I knew there was a blood supply going to his foot. That was my main concern with this staggered appearance of his leg. Was there any sort of blood supply loss? And I was like, right, next thing is we've got to get his leg straight. Paramedics on its way, but it's got to go in a splint. And I was saying, let's get your leg straight, and he was very apprehensive. He didn't want to. I tried a couple of times to say, come on, we need to, before I knew he knew what was best. So it's like, right, okay, we won't move it. When we did move it, once he had a bit of gas and air and the paramedic was there, he started to bleed quite heavily. Now, if we'd have done that earlier, which was the right thing to do, potentially we could have been dealing with a secondary problem of quite a lot of blood loss.
Blood loss, yeah.
So a blessing in disguise not to move it at that time. But that's certainly the biggest injury I've dealt with face to face. But then I've worked with some athletes that have just had careers completely riddled with injuries, and due to the nature of their sport, these injuries are big. They're lifting big heavy weights, they're pushing big heavy things. They can get some serious injuries.
See, I always thought that martial arts will have far more serious injuries than any other sport. But being in martial arts world for the last 3-4 years, I know that's not true. Every friend that I have that plays football as an amateur or rugby, they always complain. Oh, it's a shoulder, it's my arm, my knee, my ankle, my whatever. I very rarely see people with serious injuries practicing martial arts. That's so strange. Is it because we naturally learn how to protect ourselves?
There's an element
guard,
of that.
You check kicks.
Yeah.
You condition your body more. I don't know whether.
I don't think many MMA guys or boxing guys who do it properly. You can't just sign up and 2 months later expect to fight.
Yeah.
You can do. You probably get hurt. You do go on a big journey, don't you, to get your body to where it needs to be, and that has to be beneficial. You get a guy who's never been put into any sort of submission hold before. It's an eye-opening experience when someone's trying to retch your shoulder backwards, where you're like, hang on, where's that going? But I think most gyms now are really sensible. Awesome coaches around that. It's not about pushing the body to its limits every single session. You will do like heavier sparring in the end of fight camp. You've got to, but not every session is about trying to break things.
Do you know Firas Zahabi? Have you heard of him? He's an MMA coach for TriStar Gym in America.
Oh, in America, yeah.
Yeah, so several things that he says are exactly what you said. So it's volume over intensity.
Yeah.
It's like training should be addictive. Never be sore. So stop training before you feel pain.
Yeah.
It's all of these like little things.
Yeah.
And I'm so happy because I discuss with my friends, the world of martial arts and how the world is changing, that almost everyone now is training a sport. and I love it. It's fantastic. So we have more understanding of how to warm up, how to stretch, how to train, and it's like we're on this sort of self-educating journey with anything, whether it's cycling or volleyball or kickboxing. I apart from having an amazing coach with Ryan and guys from Survival Kickboxing, I teach myself so much just by listening to videos, podcasts, and reading, obviously. So I think it's amazing.
Yeah, and it's important to expose yourself to lots of information and cherry pick things that you think might apply to you, and try them.
Yeah.
We said this earlier on. It's not everyone fits into the same category of sleep. Let's talk about sleep quickly. The best thing, and it's free for recovery, is sleep. I'm thinking of one lad now, and if he watches this, he'll know I'm talking about him as well. He literally gets by on 3 hours sleep a night. He trains a lot. So he's boxing. He coaches boxing. He's yet to participate properly in boxing. You won't mind me saying that. But he does get by on very, very, very small stints of sleep. Whereas if you look at the research, and I'm not going to quote exactly the stats, there is a bigger risk if you have less than 8 hours sleep than someone who gets 8 hours more. I can't remember. It was enough for it to be a bit, whoa, that's actually, if there's any reason to get to bed early, that's it.
That's something that people really underestimate, the power of sleep.
But again, like we just literally, one person, 3 hours, and he's able to train to a high level. Will that catch up with him in time when he gets a bit older? Maybe. He might have to change his ways and go, I need to sleep more.
Yeah.
But right now, for him, training to a high level, whereas others, they need to sleep. I've worked with international rugby teams, and in their schedule, it says, it's in the diary, go to sleep. They have set times throughout the day, so they train heavy, go to bed. We want you to go to bed, and we want you to try and sleep for at least, and they wear little sleep monitors, and you're getting into high level data collection there, really trying to get every ounce of action out of that player.
Wow.
But sleep is really important.
That's amazing. And actually, because we're talking about recovery, that's a good. We can smoothly move to recovery. For many years, there's been this theory: if you have an injured muscle or whatever, cold compress.
Ooh.
Or put it on the cold water, or
here we go.
Yeah, I think things are changing a little bit.
Yeah.
So there's a lot of talk about heat being more helpful. So sauna, things like this. What's your take on this? So would you, if you bump your head, would you put like a bag of frozen peas on your head, or would you?
So let's look at the reasons. Let's look at the reasons why you would do that. Yeah. So you bang your head, like you said. You're feeling lots of pain. When you put the frozen peas on, your body picks up on the temperature quicker than it does the pain. So all you feel is cold. So ice is a very good analgesic. It stops you from feeling pain. So let's say you've had surgery on your knee, and because surgeons go in and do their thing, they don't go in there really nice and gentle. They've got to get a job done, so they can go in and get it done. Usually the knee will swell. It can be quite sore. Put a bag of ice on it. Oh, it's not sore now, it's cold. So this is my belief, and I know there'll be a few people going, I don't agree, but this is my belief. I will use ice clinically or recommend it to someone purely to help with pain. It doesn't reduce swelling. It doesn't speed up the healing process. Do you seriously think if you put a bag of ice on your knee, if you've got something deep in your knee that's injured, the ice is going to penetrate down to chill it?
No, I don't.
It won't happen. The ice will melt. You'd have to put 20 packs on continuously, and then you're going to get frostbite of the skin.
Yeah.
So it's great for the analgesic side of things. Like I say, why would you want to stop swelling? You have to swell for your body, for your brain to know you're broken. So swelling starts that chemical reaction of you're injured. Can you send some of the fixing cells to come down and help get this area sorted? So swelling's really important. It can still be managed, with compression.
Yeah.
I know we're going to get on to Kelly Starrett,
Yeah.
but he does flossing, which is a different belief, which I quite like. But yeah, you need to swell. So for me, ice is good for pain. You can say the same thing for heat. If you apply heat to an area, are you really going to get heat down into that?
Yeah.
Not so much so, but certainly, there's no harm.
I totally agree, and as everything else, I did loads of research about it, because I had sore muscles, and usually everyone says, oh, cold bath, like have a cold bath when you finish.
Yeah.
I said, okay, how about hot bath, or just go for a swim and then for 20 minutes to really really hot sauna. And you're absolutely right. That's exactly our body to recover properly needs to swell a little bit, and then it needs to feel the pain, because the pain will send signals to your brain. Listen, this part of the body needs fixing, and it will send all these.
In a nutshell,
soldiers.
That's it. It doesn't need to be any more complicated than that. And you can make it more complicated if you want to,
but it's not.
But you don't need to. You just need to think of it as simple as that.
Yeah. So I usually have very hot bath after very intensive training sessions when I feel any pain.
Yeah.
But there's still this this traditional way of just ice.
Yeah.
Ice on a sore.
I think the old acronym is RICE: rest, ice, compression, elevation.
Yeah.
Which was brilliant 20 plus years ago.
Yeah.
It's moved on now, and there's lots of research that shows actually ice didn't do what we want it to do. You don't need to be applying it like you do, certainly under the pretenses of it helping you.
Yeah.
It's good for the pain side, like I said, but it's not speeding anything up.
So it might be used temporarily halfway through the football game. Someone
takes a bit of a bang, and you see it in between rounds. They partly do it if a guy hasn't got a specific injury. You see the cornermen rubbing ice on the chest or the back of the neck. That's just really to try and control breathing, just to try and get their deep breaths under control. But for me, no, not ice.
Yeah, good. Okay.
Movement. You can safely move an injured limb to put a little bit of stress through it to get it to heal better.
Okay. Because normally people say don't just rest.
Don't rest it. You'll decondition. So if you sprain your ankle and you say, I can walk pain free, but running, it's really painful. Don't run, but do lots of walking, because that little bit of stress you're putting through your ankle will actually help flush it out and actually get it a little bit stronger. That's one thing I do clinically. If someone comes in, especially sports, but no, not even that, take that back. Someone comes in, I will keep them doing what they want to do, but to their tolerance. So let's say little old Doris wants to go out in the garden and mess around planting plants, as you do. If she can say, I can do it for 20 minutes before I just start to feel it niggle, fine. Go and do it for 20 minutes and then ease off. And hopefully that 20 minutes goes to 25, goes to 30, goes to 40, because she's exposing it to a little bit of stress, but without making it too angry. Same with a runner. If a runner comes in and says, I can get to 7 miles before my Achilles starts to talk, okay, right, let's keep you around about 6.5. Let's keep you running, because that's really important, psychologically and physically.
Yeah.
And then let's build your tolerance up bit by bit.
It's slightly counterintuitive because normally stop running for a couple of weeks, let it rest, and then start again. But then there's a higher risk of an injury occurring again.
Yeah, you decondition.
Yeah.
You lose, not muscle memory, but you lose a bit of muscle conditioning. And then you go back because you think, I feel great. Maybe do more than you should.
Yeah.
And then you got overload.
Overdo it, absolutely.
And then you're back to square one.
Absolutely. Again, with your experience, you've worked with a lot of really high-level athletes.
Mm-hmm.
Okay, so working with them, have you observed any weird exercise regimes or certain work ethics that are worth, mentioning?
I think from the ones that I've had the pleasure of working with, work ethic is the number one thing. And with work ethic, it's about the detail. So, and I think a lot of them would agree they get better with this with age, because when you get older, you've got to do more. You can't recover as quick. So instead of spending your evenings at Nando's with the boys, it's at home on the foam roller, making sure you're in a better condition for the next day. But what a real good athlete will do is invest time in working out what's good for them and actually investing in it, whether that be getting regular massage or using like a massage gun. Have you seen those?
Tim Tum?
Oh, there's hundreds. I think that's an Australian brand.
It could be
something. Yeah, that's also the name of
the. So they basically softening your.
Yeah, it just again, the belief is it's disturbing the cells within the muscles, blood tissue, blood inflammation, byproducts of exercise, and just forcing it to move, a bit like a massage. I like them. I don't think they do everything they're advertised to do, but it's a handy thing to have in your bag, just before you train, just to sort of wake things up a little bit.
Oh, so it's a prior to training.
It can be, or post, or post. I try and run a bit, and I use it before and after, definitely. But the number one thing that the elites do is detail in every manner of what they do. That will be nutrition, that will be hydration, that's getting to bed, that's analysing their game, the opposition's game. It's the detail, and that's the fundamental difference for me, for those guys.
It must have been fascinating to just observe them.
Oh, it's
like
brilliant.
These rugby teams, or because I know you work with the strongman, Laurence.
I have worked with Laurence previously. Yeah.
So my God.
Yeah, and again, I was lucky enough. He took me to a show once. I'm a big strongman fan, and seeing these guys in the flesh, looking around at the small ones like that, the bigger ones, even taller. But just seeing their own little things that they do was really interesting.
Yeah, and he's really popular.
Yeah, and Laurence, he's a fantastic guy.
He's got his show as well, and he's doing his interviews with other
doing around with all the
strongmen.
He's one of the nicest athletes I've ever worked with. Had a very unlucky career with some injuries. Yeah, he's had some, but that's the nature of that sport.
I mean, the weights they lift. It's just ridiculous.
And I don't think people understand it until you go to a live show. When you see someone pull maybe close to or over their maximum lift, and then everyone else does their lift, and then half an hour later they've got to go and carry a car, and then half an hour later they've got to lift the Atlas stones. It's an incredibly draining, that is one hell of a sport.
Yeah.
And if people saw the behind the scenes, what these guys do, it is absolutely incredible.
I do. Yeah. Well, I used to watch it more when, because I'm from Poland.
Okay.
Where Pujanowski.
Pujanowski. Yeah.
But they're amazing. They're amazing. Not
definitely.
all of them look very muscly. Very often they have this sort of
power belly,
like a power guts.
Yeah.
But oh my God, they're strong.
Yeah. They. Like Laurence has said many times, and a lot of strongmen say this, there's only a very tiny percentage of the world that can do that sport.
Yeah.
You can want it as much as you want, but you have to be gifted to do that sport. That's why there's not many of them at that level. And that's why you see the same faces for a very, very long time.
Yeah.
And then the younger guys come through. But it's not many people who can do what they do. And in many ways, not just the lifts, but the lifestyle. You eat 20,000 calories a day. That's a ludicrous amount of food. I'm a big boy, but that's a lot of food. Yeah, all right, they're training to a level where they need it, but that's not that's not easy to do.
No, and the discipline and hours and hours of hard work. It's
just drilling in those movements. So that deadlift is just automatic. Step up to the bar, no matter what's going on around you, and rip that bar out of the ground. It's just automatic. It's brilliant. One of my favourite sports.
Yeah, well, very entertaining to watch.
Yeah,
definitely. Becoming a supple leopard.
Yes.
Okay, so actually, the saying, "Sitting is death, movement is life." I've taken from the author, but I'm sure it's been around, many years earlier. What's your take on this? Because it's more or less what I do for a living. Because I'm a moving and handling specialist, so I train people how to move patients in hospitals and nursing homes, etc., etc. But for the last few years, moving and handling has evolved, and I do a lot of DSC assessments.
Okay.
So display and screen equipment. So people, working in offices, driving cars, buses, things like, even working factories, looking at ergonomic approach to their workstations. Influencing them, recommending, advising, move. Come on, don't sit for longer than 20 minutes.
Yeah, sure.
So what's your take? Because you work in this industry as well.
Yeah.
What's your take on this? Movement is so important.
It's really important. So movement nourishes the body. It nourishes the mind. It most certainly nourishes the joint that's moving. So an example being, if you don't flex your knee through its full range of motion regularly, you will start to stiffen up. So bending down, let's say as an example, becomes a little bit more of a chore. So the soft tissues around it can sort of stiffen up a little bit. But more importantly, the joint itself, because it doesn't have that compressive load going all the way through it, you may start to get weakening of what's called the articular cartilage, so the cartilage that lines the end of the bone. So my belief, and I do work with some elderly clients. I'm starting to get a few more, but I think we've got this kind of belief, certainly in the UK, once you hit a tender age, let's say 60, say retirement age, 60, 65, it's time to
slow down,
go easy, be sensible. And that's where you really start to see deconditioning occur, and in many ways. So someone who is generally fit and active, because they think, I'm frail now, and if people tell them they're frail, really psychologically makes them feel quite fragile. Physically, you'll start to see they're scared to bend down, or they don't, and it becomes a real big problem really, really quick. Whereas me, personally, keep moving.
Yeah, I couldn't agree more.
Safely.
I couldn't agree more.
You might need a bit of guidance if you have sort of slipped off of the trail a little bit, and you've started to lose confidence. Get that confidence back and understand that movement, we're designed to move.
Yeah, human bodies were not designed to sit for a long time.
No, not at all. If you sat for a long time a million years ago, you're going to get eaten.
Yeah, exactly.
You need to move.
And I've got this very controversial, opinion that we as well, especially in social care, NHS, we are helping our patients, residents way too much.
Yeah.
Way too much.
Yeah.
And we do it because we are so caring. We, when we see someone in a wheelchair, someone elderly, looking frail, we think, I'm going to do everything for you.
It's a natural thing to show that care.
I'm going to cook your dinner, help you with, your personal care, and, do everything for you. Not realizing that potentially this person could do, 70% of all of these things with a little bit of support.
Yeah.
So even getting up from this comfy, huge chair, going to the dining room and making himself or herself a cup of tea, it's a moderate exercise.
Yeah.
And it's you're stretching your bones, you work on your circulation, respiratory system, you're
everything.
You're keeping your muscles strong and joints moving as well. But it's just so hard. It's this sort of mindset that carers have that's so difficult to break.
Yeah, and I can talk from personal experience that. So unfortunately, I lost my father a couple of years ago. He passed away with cancer, and towards the end of his battle, He was housebound, he was chairbound, but even then I saw lots of benefit in trying to get him to do what he was capable of doing. And it's a really hard thing to do because, like you say, you want to care, and certainly when it's someone as close as like your parent, you know. But I saw that even in that scenario, Dad, get up out of the chair. Come on, you can do it, because that's really important, because it kept him moving. It gave him confidence. Yeah. Because you can really quickly deteriorate if you get told you're fragile, you're sensitive, and you got to sit. And I think it's a terrible thing. You know, we should be really getting people moving.
Absolutely. So I'm running several like project initiatives in the company I work for, and it's not easy.
No, yeah.
But it's not really our clients, you know, residents, people we support that are usually the problem. It's the carers, because they are so caring.
Yeah.
And it's been the sort of culture for decades to.
It's a mindset, isn't it?
They do things for the people we support rather than support them to do these things, so they can be participants as well. Yeah, but I'm sure we'll get there.
By the way, I'm not saying 80-year-olds should be going out doing cartwheels.
No, or you know, on a treadmill. Yeah.
Yeah, go. You know, it's got to be. Confidence needs to be built, and
absolutely,
you know, and getting someone moving, and you can get massive benefits from just getting someone doing just a basic leg extension in their chair to keep their quads active.
Absolutely.
To keep their knee moving. So it can be really, really simple. You know, I'm not saying everyone needs to be running marathons every weekend.
And I know there's been a lot of research about longevity, and you know, they looked at Mediterranean countries, Japan, Scandinavian countries, and some of the things they found that the diet, obviously it needs to be the sort of I don't like this word, holistic approach. It's a sort of a cliche word, but that's what it is. So you have to have good diet, balanced diet. You have to have some sort of movement. So apparently, in Mediterranean countries, the houses very rarely are bungalows. So whether you like it or not, you have to go up and down the stairs, and it gives you, 5, 10 exercises every day.
Yeah.
Okay, you have to walk to do your shopping. You have to go and see your, brother, sister, family. Again, relationships. Apparently that. Because of having close relationships, either with friends or family, it makes us live a little bit longer.
Yeah.
It's all of these little things. And,
it is little things. Go over to Asia. You don't sit at a bus stop waiting for a bus. You get into a squat. In that side of the world.
Oh, really?
Everyone, yeah. There's loads of articles out there that show these guys. A resting position is a squat.
Wow.
Can you get in a squat for 10 minutes?
I don't think I can.
If you look at Kenny Starrett's work in the Supple Leopard, he does his 10-minute squat test. Can you? Is it? He deems good homeostasis, so your body is in good nick. You should be able to get into the bottom end range of a squat and be comfortable there for 10 minutes.
I'll do it tomorrow.
Things will start to talk to you. You'll start to feel, that knee gets a bit funny. That ankle feels a bit stiff. Or my back's a bit sore. Whereas you go over to like Asia, it's normal to be in a squat position as a resting position, full range.
Whoa.
Even deep into their 80s, years of age, they can get into a full squat because they haven't stopped moving.
Yeah, that's
Whereas
so important.
Here, the moment kids hit sort of secondary school, end of primary school, certainly secondary school, shoved behind a desk, let's learn. They're not having enough time to express movement.
Yeah. And
then that carries on into the working world.
That's very true. There isn't enough PE lessons, and then
there
are not encouraged.
There are some schools. I think there's some in Western-super-Mare that are trying to get stand-up desks. And there's lots of research behind that shows the brain functions better when it's moving.
Apparently, productivity in the office, because I purchased a standing desk for my office.
Yeah.
And apparently, because I did some research, productivity increases by 20%.
Yeah.
Just because of existence of standing desks. Because people every now and then will go, make a phone call just standing, or do a quick project on their laptop, or have a chat standing. So it apparently increases productivity.
Yeah, no, definitely.
That makes sense. What about, because obviously become supple leopard, it's like slightly more modern approach to movement. Have you come across anything else that's modern approach, or maybe a piece of equipment that's revolutionized the way we approach recovery or
there's lots out there, and you've covered quite a few areas that you could go down each path and talk about, but within sport there was a system called the FMS, so it's called the functional movement screen, which is a group of exercises that you would perform, something as you would do a squat, and you've got some criteria that you would look at which deems to be what is a good squat, and then you would score each attribute. So you'd say, right, can they keep their feet flat? Yes. Right, so that's top score. What does that do? What does this do? Oh, that's not very good, that's very good. And then you come up with a score at the end. Not overly liked, and there are some flaws with it, but for me I think I enjoyed using it because it was a good way of just looking at someone simply.
Okay, yeah.
Not too much detail, but it just gives you an idea of what's going on with that person. And I think that's where people picked this apart, the functional movement screen. It doesn't give you a definitive, and I don't think its purpose was that. It was more, this is just a loose summarisation of what this person does, and it looks from top to toe. So it looks at how a person hinges, how they step, have they got any limitations in their hip when they step over something. So if you put that into the real world, if you haven't got a posh bath, got to lift your leg to get over the bath, you can relate it to real world actions. So I quite like the FMS, but there's stacks of things, and for me that's probably the biggest one that I've used.
Okay. There is at the bottom of White Ladies Road, there's a shop called Back in Action. Back in Action. They do a lot of ergonomic stuff. Standing desks, really cool, stylish, ergonomic office chairs, all sorts of things.
Right, hang on, stop you there. A chair's a chair. So if you buy a chair for 500 quid, or if you buy a chair for 50 quid, or a fiver, it's a chair.
Yeah.
End of. Sitting is sitting.
Yeah.
Doesn't matter what position it puts you in, you're still in this seated position. Absolute. Sorry if you've got shares in chairs, but for me,
we haven't.
Absolute marketing nonsense.
But they've got this device called Mobilizer.
Okay.
It's like a bed.
Yeah.
You go on it, and it got this like spikes.
Okay.
Moving
Yeah.
From top to bottom of the body.
So that's they use those a lot in hospitals. So if that's someone who's bedbound for a particularly long period of time, it's just trying to force some sort of movement, so lymphatic drainage. Yeah. So it's just trying to make sure you haven't got too much sat still. Got its place, but no. I've got quite strong beliefs. A chair is a chair.
Well, if you sit too long on any chair, you will suffer consequences.
It's the same position.
Yeah.
Same position. It doesn't matter if it's got an arch support or.
I know that there are some chairs that they're called Agile Chairs, so they basically force you to change position, and you have several options to sit on them. So they are pretty good.
There was a big study in America years ago now, where they got everyone to sit on a gym ball, the big gym balls, and they saw a huge decrease in lower back pain because people were having to sit and stabilise because the ball was moving. Someone fell off that ball one day, and the company got sued. So everything went out the window and went, well, obviously it's too risky. Hence why...
Because of one idiot.
Because of one person.
Who couldn't sit on the ball.
Hence the guy who spilt his hot coffee from McDonald's, it now has to have contents may be hot written on the cup.
Yeah.
Oh yeah, I've ordered a coffee. It's going to be hot, isn't it? Generally. So it's like, but surely people can sit on a gym ball in an office. If it showed positive results,
why not?
Do it.
And then again, you have to move constantly, change your position rather than sit.
But I have been quite
too long.
Harsh on the chair there. I will say, looking a bit odd now, but if someone has a £500 chair but it makes them feel like their back pain is better, that's a good thing.
Yeah.
I just think I could do things with better outcomes without having to rely on a chair.
Yeah.
And I know that sounds a bit what word am I looking for? Contradictive of what I've said. Psychology is massive.
Yeah.
And that's all that's a big part of what I do. I'm not a psychologist, but I'll use an example of a guy I've got under treatment at the moment. He's got a really minor groin strain, but when he walked in, it was like his leg had been blown off in war. He was hobbling. By the end of the session, got him jogging on the spot, moving, and all I did was tap into his confidence, or his psychology, and said, look, actually, I think your testing's really good. I don't think it's that bad. I think you're more worried about it. You're worried about something that isn't there.
Yeah.
And I've got him running straight away. He hasn't ran for 2 weeks because he was scared of it.
Just lack of confidence, and that's all it is.
And psychology is massive, so I will, contradictive, but if you want a £500 chair and it makes you feel better.
To be fair, there are some ridiculously expensive chairs that I don't think will improve
all
anything.
aids.
Yeah. But some are pretty good. Some are pretty good, especially with the ergonomic ones where you can change the height and the tilt and everything. So they do have their place, I think. Okay, so let's wrap things up. You have reopened now, as far as I
so I've been open for 3 weeks.
Okay,
3 weeks.
So how has it been in the last few months? Really, has it been really tough? Were you closed completely?
Yeah. So I can't remember the exact date, but it was mid to late March. It was a few days before lockdown officially kicked in. So we didn't know what was going to happen at that time. We certainly didn't know what was going to happen to us now. Got the message. It would probably be best to shut off my governing body. I don't know whether this is the right thing to say. I think some people have probably underestimated what coronavirus is. There's those people out there who will say, it's not as bad as what they're making out. I wasn't going to take that risk. So I decided to shut early and try and contribute to not being used unnecessarily, which is what we were all told to do, wasn't it? And
especially that you did say that you have elderly clients as well.
Yeah.
So there's a risk as well.
And even now that they're affected now, the guidelines state I shouldn't. Well, I'm not treating anyone over 65 because they're deemed as high risk. Luckily, I don't treat many of those. And I am giving them good advice over the phone if needed. But then there are people they can go and see. They have got access to go see the NHS and stuff. But no, it's been tough. It's probably been tougher opening back up financially.
Really?
Yeah, having to purchase all the PPE.
Oh wow, yeah.
I'm now doing sessions wearing a mask, visor, gloves, apron.
Oh my God, in this heat?
It's not too bad. I'm very lucky. My room is nice. It's a bit daunting though for a first time client to be greeted by this guy wearing,
full gear. Yeah.
And I'm very much I like to shake someone's hand, and I can't do that. You shake someone by the hand, look them in the eye, and welcome. I can't do that.
Oh.
But no, it's you got to roll with it. You got to go along with it. It's
Absolutely.
an interesting time.
Yeah, absolutely. So what does the future hold for Tim?
World domination.
For your business.
World domination.
Apart from that, do you have any
I've got
any clients you would like to help, or
say again?
Any clients you would like to help? Any sports athletes here in the local area that are? Oh, I'd like to fix his leg.
No, I get a real buzz off when someone gets referred to me, and a person comes in and goes, right, you've seen so and so, and they said you did this, this, and this. That's a real nice thing. And I want people to come to me organically.
Yeah.
They come to me because they've heard or seen. You do get your Instagram stalkers, and then they go, I've seen you've been doing this. I actually quite like the look of that. I want to try it. And then they come in, and sometimes you might even not end up doing the thing they want.
Yeah.
So I do cupping. I don't know if you've seen cupping.
No.
So we use little vacuum plastic cups, put them on the skin, we vacuum out the air, pulls the skin into the cup a little bit. It does many things. It leaves you with, you might have seen Michael Phelps
Yes,
with
I
the,
did see
with the
him,
bruises.
yeah.
So I do things like that, and people are like, I want that. And sometimes it's a case they just want to walk around with the bruises on show. And then you get them in and you assess, you go, actually, I don't think that's the best thing for you. I think I need to do this with you. But what I try and do is give them the best and honest advice of what I see in front of me.
Yeah.
So I don't approach people. I let them come to me, because it's a really important thing that you get on with your therapist. You know, I don't know it all. I will never claim to know it all, and I don't think anyone should. But if you can connect with someone, that's far greater than someone who might be able to recite the whole of Kelly Starrett's book word for word.
Yeah. Absolutely.
Does that make sense?
Yeah.
You know, and that's a powerful thing. And I like to think I'm quite good at.
Yeah.
I'm quite a people person.
So basically, expand, have more clients.
Yeah, and just
help.
Yeah, and just
people. Yeah.
Yeah, like I said to a client the other day, I actually don't enjoy the whole business side of things. I don't. I hate it. What I'd much rather is turn up to my room with a queue of 30 people outside, and they just walk in one at a time, and I do what I need to do, and then right, next one. And that way, not the whole advertising and all the other nonsense that comes with business. I just want to help people. Sounds cheesy, but it's true.
Yeah. Well, yeah, that's what it is. That's what I would love to do as well, and see their smiles as they leave.
And I've got a few things in the pipeline with regards to recovery that no one, I believe, is doing in this area.
Ooh.
So I'm hoping to jump on that quite quickly. So watch this space on that one.
Okay. So where can people find you? So
social medias.
Okay.
Just TG Soft Tissue Therapy. Clinic is based in Brimscombe Stroud. So from Bristol, it's about half an hour. And I've got people that come from all over. I had someone contact me from Coventry last week, and I after a telephone conversation, I said, I can get you to someone a bit closer than that, but I want to come to see you. I really appreciate that, my friend, but let's get you seeing someone a bit closer first, who I trust. But yeah, I can see anyone. If anything, just throw a question out and just say, I've done this. What do you recommend? And I'm very black and white. It's, listen, it's going to be okay, or get yourself in. And
you've got plenty of short videos on your Instagram, because I went through it the other day. So you've got
one of my stalkers.
Yeah, I am. Yeah.
Yeah, I try and give out little nuggets of information. It's important to share knowledge. What I do make people aware of is the content I release might not be the best thing for you. However, it's nice for me to be able to make it, put it out there. Some people might get great benefit, but also for me, if I get someone in and I say, oh, I've done a video, it's on my, it's an instant access resource for them to access and look through it.
Brilliant. Okay. Tim, it's been a pleasure.
No, I've enjoyed it. Thank you so much for having me.
And I'm sure you'll wrap my hands pretty soon as well. I'm really hoping that we can start training again and fighting, and because I've got very itchy fists and legs, I would like to kick and punch. So hopefully Ryan can get me onto an event this year. Yeah. Okay.
Fingers crossed.
Yeah.
Plenty of fights left in you yet.
Yes. Thanks so much.
Excellent. Thanks for having me.